Hi, I'm Giri Srinivasan, physical therapist with Instep Physical Therapy. I'm practicing physiotherapy for the last 20 years and treating over 16,000 patients in Edmonton. 50% of that caseload is lower back pain. Our website is www.instaphysio.ca. Today, we're going to discuss about lower back pain. Top 3 exercises to fix it. That is our topic for today. With all the patients coming into our doors for the lower back pain, there are certain things commonly I notice in their body, missing components I can call it. And this missing component is not even concerned with the lower back. Most of the times I feel lower back pain or lower back is just a victim. The culprits are somewhere else. The culprits can be on the top in your upper back, it can be in your hips, it can be in your ankle, it can be anywhere in your body. So basically today, the plan for this video is teach everybody with lower back pain or not with lower back pain to identify what are those missing factors in their body and how to check whether things are working properly or not in their body. Number one thing we're going to talk about is your upper back mobility. Okay, let me show you how to check yourself whether your upper back is moving or not. Okay, now we're going to show you guys how to check if your upper back is moving properly or not. Why it is so important to know your upper back is moving or not is if your upper back is not moving, then the lower back is strained so much with so much forces going into the lower back. Lower back is created for stability, not for mobility. So when your upper back is not moving, lower back try to compensate, it's going to move much more and it's going to have a lot of wear and tear. Okay, Paul is here. Hi, Paul. And Paul is going to help us to demonstrate how to check your upper back mobility. Paul, can you come on your hands and knees, please, on the bed? So first, you need to go to this position, your hands and knees on the bed, and then you need to lean back a little bit so that you're locking your lower back, so that when you do the movement is localized only on your upper back. Paul, I want you to take your hand to the back of the neck here. Okay, we're going to check how Paul is moving, whether he has good mobility on the right side and the left side and symmetrically. Okay, Paul, can you rotate up towards? Okay, that's pretty good. Usually it's about 20 to 30 degrees of rotation there. Paul has good mobility on that side. Come back, Paul. Let's check the other side, please. Keep your hand behind the neck and go back a little bit. Good. Okay, you can see the restriction on the left side for Paul. Paul is not rotating that well on the left side compared to his right. He has asymmetrical rotation. That is going to put a lot of stress in the lower back. Okay, thank you, Paul. Go back to that position. That is the one thing I want you guys to check it out. How is your thoracic spine or upper back is moving? Go check it out. Hope you all checked out how is your upper back is moving and how symmetrical and asymmetrical you guys are moving. That's the number one thing you need to check, and that's the number one cause for your lower back pain as well. The second reason a lot of people having a lot of lower back issues because their foundation is not strong. What I mean by foundation? Your pelvis and your hips. This is your foundation. The two pelvic bones and the tailbone is your foundation for your spine. We have to check how stable is your foundation is. You can't have some structure on top of the unstable foundation. So we all should know, or you all should know, how stable is your foundation. I'm going to teach you guys how to check how stable is your foundation is. Okay? Okay, so we're going to check how stable is Paul's foundation is. It's very easy to do at home. You guys can do and practice at home as well, but make sure you are safe, not falling. Okay, Paul, keep your hands on the waist. I want you to bring your right knee up 90 degrees towards the ceiling and hold it right there. So now we are checking the stability of the left hip, how stable it is. And you can see Paul is not too bad. He's just leaning a little bit to the left and he's not breathing. Paul, can you breathe normally? Okay, and don't hold your breath. And that's how his stability is on the left side. Let's check how stable his right hip is. Paul, come on to your right hip and lift your left leg up 90 degrees. Now we are checking the stability of the right hip. You can see Paul is not that stable. He's shaking a little bit on this side. He's leaning too much. He's not breathing. Breathe, Paul. Try not to lean. You can see how different is right hip stability compared to your left hip stability. Thank you, Paul. So this asymmetry in the hip stability, sometimes you can be bad on both sides. And most of the people I see, they're bad on one side. So that is an unstable foundation for your spine to be on and function properly. So the third thing we're going to check is how much your gluteus muscle is working or firing. A lot of times what I see with the patients with lower back pain, the brain shuts down the gluteus, which is your big muscle in the back, right? When the glutes shut down, the lower back has to work 200 to 300% more, and it causes a lot of strain in your lower back. And I would say at least 9 out of 10 patients I see with lower back pain have their gluteus firing, either shut down completely or minimal function. And we're going to teach you how to check yourself how good is your gluteus working. Okay. Paul is lying down on his tummy. We're going to check how strong his gluteus is firing on both sides. First, we're going to go check his right side. Paul, I want you to bend your knee here, and then I want you to lift this leg off the bed for me and make sure your pelvis is down, you're not twisting and compensating. Paul is lifting his leg, not too bad, a little bit shaky on that. He's also making sure he's extending his hip without lifting his pelvis. I would give him about 8 out of 10 for his gluteal strength on that side there. Not too bad. Okay, Paul, come down really slow. And make sure you guys don't drop the leg too fast down. Sometimes when you guys do this, you can experience some cramps in the hamstrings. And if it happens, take a break and do it again. We're going to check how is his left glutes working. Paul, I want you to bend your knee and then lift this leg off the bed for me. I can see that Paul is kind of trying to compensate, lifting his pelvis quite a bit there, and also he's not lifting that high. I'm going to avoid that compensation, see where it's going, and then lift higher, higher. He can't do that because he's not that strong in his glutes. So his left glutes is not firing for some reasons, is underactive, and that's going to cause a lot of trouble in his lower back and shearing forces on the lower back. Okay, so this is how you guys have to check how good your glutes are firing. I want you to go and check it out and let us know. Okay, so you guys have checked out how is your upper back mobility is, how is your hip stability is, or your foundation stability, and also how good your glutes is firing. Those are the 3 common causes for your lower back to go out of whack and not functioning properly, putting stress in the lower back and causing strains and joint immobilities and also disc problems. So now we're going to teach you one important exercise for all the 3 of the deficiencies you guys found out that you have. Okay, first thing we're going to talk about the thoracic spine, the upper back mobility. What one thing you can do to improve your upper back mobility? Okay, so we're going to do that now. Paul, can you go on your hands and knees, please? This is kind of very similar to what we did to see how good it's moving too. Okay, we're going to go to the same position. Then you're going to lean back. I'm going to come on this side so I'm not blocking you guys. So you're going to lean down a little bit more so that you're kind of arresting that movement from the lower back, so we are getting a pure rotation from the top. And Paul, I want to keep your right hand behind your neck here. Good. And then you're going to rotate out and turn your head along with your head on your arm, please. Yeah. And come back there and stay nice breathing in through your nose, out through your mouth. Again, up. Good. And make sure he's not shifting his body weight here, right? Don't shift too much. Okay. Good. Beautiful. Come back down. Okay, now try the other side. Okay, so when you do this at home, I want you guys to do alternate, one on the right and one on the left, and I want you guys to do alternate all the time. Come on, Paul. He's a little bit restricted here. Push it on the end. Nice breathing. Don't forget to breathe, and then come down. I can actually hear his lower back and upper back cracking a little bit. Okay, go down. More. Take it down more, Paul. When you come up, and then I want you to take it down more too. I want you to go there. Good, and then come back up. Beautiful. So you're getting that full winding and unwinding is happening in your thoracic spine. This is very important. Okay, you can finish there, Paul. So this exercise is not only for the lower back. This is a great exercise for your shoulders too, because if your thoracic spine is not rotating well, your shoulder mobility and shoulder function is going to be quite hampered. Okay, the next one we're going to do is how to improve the stability in your hips, or the foundation we talked about. The one exercise I'm going to teach you guys is in a position called half kneeling. Paul, can you go on the bed here? One leg in the front. Go in the side that way. Yeah. Good. So this position is called half kneeling. A lot of people I see, it's even hard for them to go into this position. They'll find it really hard and unstable in those good position. So this position is half kneeling. So what we're going to do, first attain this position on the ground is better, and then we're going to do something called chops, half kneeling chops. So we can have any object in your hand, for example, a soup can or a milk jug or whatever in your hand. And I imagine that Paul is having something in his hand. Hold your hands together, Paul. Okay, it's not to be very heavy. It can be anywhere from 2 pounds to 3 pounds to 4 pounds. And the weight in the hand doesn't matter. The movement pattern matters. Okay, he's in the half kneeling position. Right now, we are working on the stability of his right hip. So we're going to do a chop. So Paul, I want you to lift this arm right here, then bring it all the way down to your right hip. Good. Can you do that 5 times, please? This is half kneeling chops. Again, as I said, you can hold anything you want on your hand, and make sure that you're not leaning too much on the other side. The foot should be in front, kind of one fist away from the knee, not too far out. Good. Can you try on the other side, Paul? Good. In the front, just one fist away from the knee. Good. A little bit forward. Good. Try to do the chop. You're going to start from that end, then you're going to come back to this hip. So this is one of the great hip stability exercise you can do to get your foundation strong. There is a lot more. This is just a basic thing. There are different levels of stability exercises after this. Thank you, Paul. So that's what you guys are going to do to improve, one of the things to improve your hip stability. It's a basic stuff. The last one we're going to see is how to improve your gluteal firing, right? If your glutes is under firing, how to make it do the better job. Okay, Paul? Can you go on your hands and knees again? And this is your starting position, right? Your hands and knees. And I want his hand below the shoulder on both sides, shoulder width apart, and knees also kind of hip width apart, not too wide. In this position, we're going to ask him to lift this leg up, his left leg up straight without twisting his pelvis. Usually what people do when they do this, they rotate their pelvis, they also lean to the other side. We don't want that to happen. We want you to stable here, not twisting, not pushing to that side, and pelvis square. If you keep a scale or a book here, it should stay very stable right there, not tilted. And right now Paul is here. I would cue him a little bit. I want you to go here, Paul. Keep it in extension. This is neutral. We don't want you to hold it in neutral. We want you to extend your hip. Extension is 10 degrees more than neutral. So this is where your glutes fire maximum. I want him to do that. And you can see this is firing. That's getting harder there. So up there, and try to hold there for 10 seconds without holding your breath. Always make sure you breathe normally. Because a lot of people we find when they hold that position, they hold the breath too. Make sure it's not happening. Okay? Now Paul is holding there. And Paul, you can bring it down slowly. Now try the other leg, please. Okay, so here also he's going to do. Make sure it's coming up and holding it for 10 seconds. Try not to lean to this side. And holding it for about 10 seconds, then come down slowly. Come down slowly. Once you get better in holding 10 seconds, you can improve that to 20 seconds and 30 seconds. Another thing is some people will have problems doing that with their wrist. If they have wrist pain or something, you can adapt a knuckle position if you want to, if your wrist is sore when you're doing these exercises. Thank you, Paul. So these are the 3 exercises to kind of take care of the 3 major deficiencies you find with your body which causes lower back pain. These are the top 3 exercises everyone with lower back pain should check themselves and also do. This is basic stuff. For more information or more exercises, more levels of exercises, you can always call us. Again, we are physical therapists from InStep Physical Therapy, located in city of Edmonton in Alberta, Canada. Get in step with your active lifestyle. If you like this video, please make sure that you subscribe to our video channel and also share it with your friends and family so they can also get better results with their body. And also click the link below if you want to contact us to make an appointment. See you guys soon. Bye.